Ladies and gentlemen, very happy and delighted to welcome you all to the virtual launching event today with the very new reports from UNDP. First, the report on update the COVID-19 socio-economic impact on vulnerable households in Vietnam. And second, the report for rapid assessment on the design and implementation of the government's second support package for those affected by the COVID-19 pandemic according to the resolution number 65 and QCP. And I am Lan from the Innovation Lab of UNDP Vietnam, and I will be the MC for the event today. So please kindly note that you may follow the events on YouTube and on Facebook of UNDP Vietnam, and you may follow the whole event on those two platforms in both English and Vietnamese. So first of all, let me lead you go through the agenda for today. So first of all, we'll have the opening remark to be delivered by Mr. Terence Jones, the resident representative for the acting resident representative of UNDP in Vietnam, and then we will have the two presentations from the two presenters, and then we'll have the Q&A and open discussion for about 1 hour with our panelists and also with the audience in order to collect your feedbacks and comments on the two reports, and then we'll have the closing remarks. We intend to end the event at 11:45, so we'd like to have your support to follow the whole course of the event from now until 11:45. And may I now first of all invite Mr. Terence Jones, the acting resident representative of UNDP in Vietnam, with the opening remark. Xin chào các quý vị.
Online virtual launch and discussion of two reports supported by UNDP and prepared by our partners, the Center for Analysis and Forecasting of the Vietnam Academy of Social Sciences and the Institute of Labor Science and Social Affairs of the Ministry of Labor, Invalids and Social Affairs. I'd like to welcome in particular representatives from the government, from the international community, researchers, and of course our media representatives who are with us here today. Before presenting the two reports, I think it's important we pause and acknowledge the suffering that has occurred in the last several months for thousands of Vietnamese who have died, hundreds of thousands who have suffered the consequences of poor health, and the millions who've seen their income and livelihoods reduced by the socio-economic impact of the pandemic. I think it's important to also acknowledge the tremendous efforts made by the millions of online workers, particularly in the health sector, but across society, that have tried to respond to the ferocious impact of this fourth wave of COVID-19 in Vietnam. We should acknowledge also the efforts of the government to respond to an unprecedented impact, as we see not only in Vietnam, but also in the region and across the globe, in trying to cope with the impact of the pandemic, whether through social distancing and other measures, through ramping up vaccinations to provide protection, and providing socio-economic support to those impacted by the pandemic. And this will not change rapidly. The pandemic is here to stay. It will evolve, and we need to be prepared for the uncertainties we've just experienced to continue. And it requires us to, therefore, continue to focus on and engineer an effective response as the pandemic evolves. The intention this morning in this online gathering is to share the main findings and recommendations of the two reports, which we hope will be an input to a consideration by the whole of society and the whole of government on the next steps in coping with and moving beyond the immediate impacts of the pandemic, and so contribute to the government of Vietnam's consideration of new policy choices and interventions that will mitigate the negative impacts of the pandemic for the Vietnamese people overall, but in particular for those most vulnerable to its effect. And indeed, it's well recognized that the people, and especially the most vulnerable at risk of being left behind, are suffering much more from this current wave than was the case earlier. Jobs and incomes have disappeared or reduced. People's savings and assets have been depleted. Food insecurity is a reality for many, along with insecure housing, while rural urban migrant workers have little choice but to return home against their hopes and aspirations for a better future. The most recent support package in response to the current wave provided some timely assistance to people who have lost income and otherwise suffered the impact of the pandemic. The reports point to a number of factors, however, that have reduced the impact of this package, particularly the scale of the resources deployed was not sufficient to address the rapidly spreading impact of the pandemic. There were also severe limitations in the targeting and covering that affected access to the response. And there were low disbursement rates because of complicated administrative procedures. And perhaps we are only learning now how to utilize digital technologies to provide a more effective response in overcoming these constraints. The reports make important recommendations to address these areas for improvement. In the context of phased reopening based on evidence of the pandemic, the control of the pandemic spread, and the ramping up of vaccination rates, the reports advocate for a substantial increase in the financial resources available in the next several months to mitigate the socio-economic impact of the fourth wave. These resources should be accompanied by accelerating the reform of social assistance policies and packages towards a more shock-responsive and inclusive system, making full use of digital solutions. We are not just facing the pandemic crisis. As you will have read, in New York this week, the General Assembly is looking at other crises we must confront, in particular climate change. And that also has tremendous impact on the poor and vulnerable in Vietnam. So across a range of issues, we need to ensure that we have in place the right policies, the right capacities to respond to crises that will not go away soon. And therefore we hope that the presentation today of these two reports will help us look at more broadly also how best to reconfigure society and government to better respond to the reality we are faced with. So I would like to now welcome you to our panelists who will discuss the reports today. But in particular, I would now like to present to you the two presenters of the reports, Mr. Nguyen Thang, the first Vice Chairman of the Socio-Economic Advisory Council of the Vietnam Academy of Social Sciences, who will present the rapid assessment of the COVID-19 socioeconomic impact on vulnerable households in Vietnam. And his online presentation will be followed by that from Ms. Pham Minh Tu, Head of Planning and International Relations, the Institute of Labor Science and Labor Affairs in MOLISA, who will present the report on rapid assessment of the design and implementation of the government's second package for the affected by COVID-19. Thank you once again for participating in this presentation of the two reports and our discussions. And I would now like to hand the floor to Mr. Nguyen Thang for his presentation. Thank you.
Mr. Chair, ladies and gentlemen, I hope that you can hear me well over Zoom. So first of all, please allow me, on behalf of the research team and also the Center for Analysis and Forecasting of Vietnam Academy of Social Sciences, to present to you the key findings from the update on COVID-19 socio-economic impact on vulnerable households in Vietnam. Thanks to the technical support from UNDP, Mr. Jonathan Pincus, Mr. Nguyen, Phong, Mr. Doan, Minh in particular. As you can see on the screen and on my slide, my presentation is structured into three parts. First of all, we have a brief summary of the rapid impact assessment of COVID-19 on vulnerable households in Vietnam. Secondly, I will talk about the key findings regarding the impacts on vulnerable households. And thirdly, I will talk about the policy recommendations. Now, this is the third round of the rapid impact assessment. The first round was conducted from April to May 2020. It was the peak of the first wave. And the second round was conducted in October 2020, immediately after the second wave of COVID-19. And this is the third round conducted in the first week of August 2021. And also it is based on the results that we obtained from July 2021. So as we have known, the fourth wave started around April and May 2021. And the third round of the rapid impact assessment was conducted in the middle of the fourth wave. We faced a significant amount of challenge for this survey, but thankfully it has offered valuable new information. It is conducted based on stratified sampling, and it is based on the sampling of the ILSSA 2018 conducted by GSO. And in the third round, we sampled 498 sample vulnerable households in 63 provinces across Vietnam. As you can see on this map, we have full coverage of the geographical areas of Vietnam. Regarding random sampling, there are 4 points to note. So we adopted a stratified random sampling approach for effectiveness. We relied on two criteria. The first one is stratification by risk and geographical levels. So we targeted high-risk provinces from May to date. Those who are subjected to Directive number 15 or 16 of the government. The second criteria for stratification is economic risks, and we've selected industries with high exposure to COVID-19 impacts. For example, tourism and hospitality or manufacturing, which have been disrupted mostly by COVID-19. And we have selected the subjects with higher risks of exposure to COVID-19 and those subjected to Directive number 15 and 16, including tourism and manufacturing. And we also made some justification to the sample to ensure national representativeness. So that is my overview of the sampling and the methodology of the survey. Secondly, I will present to you the key findings. Now, we analyzed two types of impacts. The first one is job and income impacts, and the second one is non-income impacts. First of all, Regarding the job and income impact, we look at 3 types of job impacts exposed to by households. First of all, loss of jobs. Secondly, temporary leave. And third, reduction of working hours and reduction of income. So we can look at the impacts on this slide. According to our key findings, 88% of the households said that they suffered from at least one of the defined employment impacts in July 2021. Now, relative to the 63% observed in the survey conducted in October 2020, this is significantly higher. We also look at the households in the tourism and manufacturing industries. As you can see on the slide, regarding tourism and related services households, 99.3% of them suffered from at least one of the defined employment impacts. For manufacturing, the figure is 96%. Regarding the second indicator, impacts on household incomes, we can see that for COVID-19, there has been adverse and significant income impacts compared to the survey round conducted in 2020. For example, we have household income reduction for about 30% or more experienced by 63.5% of the households, and close to 67% suffer from at least one of the household income reduction impacts. We also compare the results of this survey with what we obtained in December 2019 before COVID-19 pandemic started, which was in January 2020. And there were signs of supply chain disruption, especially that stems from China, and we have disruption of the supply chain as a result of our suppliers in China stop supplying to Vietnam. So we have incomes of the household in the survey of July 2021 reduced by an average of 44% compared to December 2019 level. We also look at other aspects of the impacts, including mental health and accommodation and housing for migrant workers. 2/3 of the households, or 66%, said that they suffer from mental health issues, for example, worry about the pandemic. And also we have about 44% of them suffer from irregular worry about the pandemic. So mental health for this round is much clearer than in the previous rounds of the survey. And for this fourth wave of COVID-19, we have a rather long period of social distancing, 2 months in the north and about 4 months in the south. And for households with limited accommodation space, it is very reasonable for them to suffer from anxiety during the recent social distancing. Food shortage and security has become a greater issue of concern, which was not present in the previous rounds and social distancing, but it has become more prominent in this round. And this is partly an issue of the disruption of the supply chain as well. What we have seen from this survey is that more than half of the surveyed household had to reduce the amount of food served per meal. And nearly half of the surveyed households suffered from difficulties in procuring food and food supplies. And this is purely a logistical issue, and the difficulty in supply of food, for example, from the production area to the consumption area, which are mainly large cities. Also, you may have observed from the mass media of the difficulties suffered by migrant workers who have lost their jobs during COVID-19, and at the same time they couldn't return to their hometown. They suffer from even higher risk because they may have been evicted out of their rented accommodation and high risk of contracting COVID-19. And the risk is even greater with prolonged social distancing measures. We also look at the coping strategies adopted by the households, and I have more details to share with you in this slide. So firstly, households have tried to cut back on their spending. About 79.4% of the survey's households said that they had to cut back on household spending, and about 18% of the survey's households had to cut back their spending by more than 30%, and more than 70% of the household had to cut back on food expenses. And if we reconcile with our different sources of data, we can see that there are many issues with food supply chain disruption, even in Hanoi as well. Now, regarding savings, often savings is considered a buffer to support households in times of difficulty so that they don't need to cut back on their basic spending. And about 30% of the surveyed household relied on their buffered savings, and about 56% of the surveyed household said that their buffered savings is not enough to support them through further months of social distancing if it had been prolonged. Another issue with the fourth wave is the difficulties suffered by migrant workers in returning to their hometown. We may have heard from the mass media of the spontaneous traveling, and that may have given rise to even higher contagion risks. And even though digital technology has been adopted throughout the pandemic in an attempt to reduce the risk of contagion, however, to date, adoption has been limited. What we have seen from the survey is that about 31% of the surveyed household use nCoV or Blue Zone to obtain information about the pandemic to prevent themselves from further risks of contraction. And at the time, vaccination rate in Vietnam was still moderate, and our survey showed that 2/3 of the respondents were willing to get vaccinated, and as of now we have higher vaccination rate, and especially given safe vaccination now, we have higher public trust. Now, regarding the support package launched by the government, while later on Ms. Pham from ILSSA will have more to tell you. However, our survey shows that about 90% of the respondents did not receive any support as early as August, and about 83% of the respondents said they need assistance, but it was difficult to get access. One of the reasons is the lack of proper guidance and instruction from the local government. Also, a high proportion of the vulnerable households said that it's difficult to access the support mandated. So given the key findings presented to you just now, I would like now to share with you some recommendations. While the list is long, but I would like to highlight only a few key recommendations. First of all, regarding the reopening. Now, this is a strategy adopted by many countries across the globe. However, we need at least two preconditions to reopen. First of all, we need to increase vaccination rates, and secondly, we need to ensure safety standards in the new normal, especially raising public awareness. Another recommendation is related to vaccination and vaccines. First of all, we need to rely on expert epidemiologists, and we should refer to experience of countries with similar contexts. For example, they can adopt very simple procedures. We should learn from best practices across the globe. Secondly, we should modify our vaccination priority and focus on key groups. For example, we should first focus on the front line and elderly people. We should target first people from 80 years and above. Then we can reduce the eligibility age to 70, then down to 60, etc. And for Vietnam, it is unfortunate that elderly people are almost those who receive vaccination latest. And now the government is taking actions to get elderly people vaccinated as soon as possible, especially those who have pre-existing conditions. Also, we should rely on an effective communication strategy, considering a short-term vaccination strategy as well as a long-term one. And given that the COVID-19 pandemic is going to last probably for a much longer time, so we need to develop a corresponding long-term strategy. Also, at the moment, the government has launched several cash grant support package to vulnerable households. However, the size of the support package is still limited relative to our GDP. And in addition, we may have indirect support such as tax and fee exemption and reduction. Despite them being important, we need to increase the size of the support, and we need to have stronger rationales to identify the specific amount. In the medium term, we need to promote institutional reform to increase coverage and to make our system more shock responsive. Given the experience of Ho Chi Minh City, valuable lessons have been obtained in order to ensure essential needs and food for households in affected areas. Also, we need to devise support measures targeting out migrant workers. They are among the vulnerable populations as well and at higher risk of contraction. However, support to them is still limited in terms of targeting, in terms of guidelines offered to local entities and governments. We have also spoken of digital technology adoption and the roles of local government coordination as well. The better coordination, the better results that we have. Also, we should think of solutions to address newly emerged issues such as non-income impacts, such as mental health issues. If the pandemic will last for a much longer period of time, another issue is food safety and supply chain safety as well. Measures need to be designed to prevent disruption of the supply chain. Another issue is how to support informal workers, especially those working on online platforms. The risk is particularly high for those who have lost their jobs. due to nationwide social distancing measures, we need to think of probably training or retraining part of the workforce to equip them with online and digital skills. And that can help to alleviate their mental health burden. There is a vast amount of digital tools and online platforms that we can tap into. So that is my presentation, and I would like to thank particularly UNDP colleagues, Mr. Nguyen, Phong, Mr. Jonathan Pincus, and Mr. Doan Minh for this. Thank you very much.
Thank you very much, Mr. Nguyễn Thắng, for your presentation. Next, may I invite Mr. Pham Minh, researcher and head of planning and international relations from ILSSA and MOLISA, with the presentation on the key findings from the assessment on the design and implementation of the government's second support package for those affected by COVID-19. Yes, thank you very much. Good morning, ladies and gentlemen. On behalf of my research team, I would like to give a short presentation on our key findings from the rapid assessment on the design and implementation of the government's second support package for those affected by COVID-19 according to the resolution number 68 from the government of Vietnam. So we know that from April 2021, that's the start of the fourth wave of the COVID-19 pandemic, and it started in the southern part of the country. And at that time, the MOLISA already gave the policy advices to the government in order to issue a new support package with the scope of 26 trillion VND, and it was intended to be applied right away and immediately to all people who are affected by COVID-19, with a focus on the workers and laborers. And now in this rapid assessment, we conducted this survey in August 2021, so a little bit later than the survey conducted by Mr. Nguyễn Thang's research team, because we taken into account the time lag by the policy actions. And in this study, or in this rapid assessment, we looked at the design and the implementation of the support package, in particular on the coverage, the level of support, the financial distribution mechanisms, and the administrative procedures. So we finished the rapid assessment at the very end of August, on the 31st of August 2021. And on this occasion, we'd like to thank UNDP and also the MOLISA working group on the implementation of the resolution number 68. Yeah, so that's really the very great support from them for us to complete this assessment. So now let's talk about the key findings of the assessment. First of all, let's talk about the design of the support package. So the resolution number 68 was issued on the 1st of July, and then the directive number 22 was issued on the 7th of July in order to give the instructions on how to implement the resolution number 68. But about the design of the support package, we found that the support package was too small in terms of the coverage and the level of support. The next slide, please. So we may talk first of all about the financial resources for this support package. So the total design budget for the package is 26 trillion VND, only 0.4% of the annual GDP of Vietnam. If we compare it with the similar packages from the neighboring countries, which is around 5% of their annual GDP. And if you can look at the pie chart on the screen, you look at the blue color, that's the suspension of the social insurance payment and or reduction of payment to insurance for occupational accidents and diseases. So it accounts up to 46% of the support package budget, and then followed by the loans. For example, the loans for firms to recover their production activities. So it accounts for 28% of the total support package budget. But however, those kind of the loan mechanisms cannot yet implemented right now during the social distancing and lockdown. And then we see that the other supports, for example, the unemployed insurance funded to job retention training, solely account for 1% only. So very small and cannot meet the demands of the workers. And for this support packages, we can see that there are 12 different policy options to support the workers, including the cash assistance for the non-informal workers who do not have the official employment contracts. So it means that this kind of support to the non-informal workers would be managed and implemented by the local authorities. So in the best case, the mountainous areas or the central highlands can receive the central budget support of up to 80% in order to cover those kind of the benefits and supports. And for the other provinces, however, they receive less support from the central budget in order to cover those kind of cash assistance. And so that has led to the inequalities in the distribution of the financial resources among different provinces and localities. Next slide. In terms of the coverage of the support package, we see, first of all, here we are happy to see that there are the two target groups which have not yet been included in the social benefits program before. These are in particular the pregnant women and children. However, if we look at those target groups, it seems that they do not yet fully cover the most vulnerable groups in the society, which are in particular the poor or near poor household and the elderly people or the lonely people. So those groups have been excluded from this support package. And so we have also found that the accessibility of the target groups is quite difficult, and also the frequency of the assistance given to them is much less than the previous programs. For example, now they can only receive the assistance every month, once a month only. And so in Ho Chi Minh City, if you remember that the assistance and support had to be delivered up to 3 times in order to meet the demands of the people in need. And the level of benefit in this second support package is not higher. Actually, I think it's quite the same as it was in the previous years, at around, let's say, 1.5 million Vietnamese đồng per month, let's say 50,000 VND per day only. So it is less than the national standard poverty line of around 2.5 million VND per month. And in several cases, that level of benefit and assistance is even much lower than the minimum wage level in some areas, in some provinces. And with such the design, we can say again that first of all, the financial resources for the support package is very small. And then how about the implementation of the support package? And you can look at this chart, and we have here the blue line and the red line. So the blue line and the red line actually is for the disbursement rate. So at the end of the August 2021, then the disbursement rate was around 37%, and for the groups of people who have the official employment contracts and who have payment to the insurance system, they may have a higher percentage of delivery of benefits. And Mr. Nguyen Thang said before that up to 90% or more than 90% of the household did not receive the assistance. But here we have the statistic figures to show how many households and how many families did receive the assistance. Maybe because we have the time discrepancy between the survey made by Mr. Nguyen Thang's research team and our research team survey, then there are the differences in the figures that we have in our hand. So at the end of August, again, around 11.4 million workers who did receive the assistance, but they were the people who have the official and formal employment contracts and who have the payment contribution to the insurance system. And for loans for the firms, for example, to pay the worker salary or to help with the recovery of the production. So it's only covering around 6,700 something workers, and Bắc Giang province seems to be the best performing province in this kind of policy. In terms of the cash assistance, although the allocation from the support package budget for the cash assistance is quite smaller than the other policy options, but if you look at the disbursement rate, it seems to be that the disbursement for the cash assistance is the fastest. With nearly 3 million informal workers who have received cash assistance with the amount of more than 3,400 trillion VND. And so if we look at from that perspective, then cash assistance seems to be the most effective policy option. The next slide. And if you look at every separate policy option here under this support package, we try to see what are the reasons and what is the status of the disbursement rate for every policy option. So if you look at first of all the suspension of the social insurance payment, then it can be implemented quite quickly because all of the dates and figures are there on the computer system, and they do not need to add any further procedures in order to implement this policy option. So now for that policy option, it's among the fastest disbursement rate was around 17%. However, the other policy options, for example, the assistance for the workers who are subject to the employment contract termination, then the disbursement rate is nearly zero. Or the assistance for the meals for the FO and F1 targets, then we didn't forecast such the very quick rising of the number of the FO and F1 patients in July and August. So if we look at the updated figures on the 20th of September, then the meal assistance to the FO and F1 patients were already 200% higher than our expected number, because the number of the FO and F1 patients increased so quickly. So now MOLISA is making recommendations to the government in order to modify some of the contents of the resolution number 68, especially in terms of the procedure for the social insurance payment, as well as for the loans delivery to the enterprises and companies, and as well as for the cash assistance to be delivered to the informal workers. Then in terms of the implementation process, the administrative procedures have been to some extent simplified for this second support package. However, the way to identify the people in need and then to deliver the support to them have shown some limitation and constraints. So at the end of the August, we achieved some results. But if we look back the implementation in July, then the implementation progress was very slow in July. Although there were many online conferences and workshops that were organized with the local provinces, and many issues were detected, but there have not been much improvement in terms of the implementation progress, because it is limited by the way to identify and then to deliver the support to the people in need. Even in Ho Chi Minh City, you see that that procedure is still conducted manually by the social workers at the villages or at the local levels. Even during this time of social distancing and lockdown, that many households couldn't access the support. And however, we have had the news from Ho Chi Minh City with the third time allocation of the support in this month, and they intend to cover more than 7.3 million people. So we hope that then we can have the disbursement rate to be higher in the next months. And with those findings, we have come up with our recommendations. First of all, the recommendations for short term. Because we have looked at the projections on the epidemics and the pandemic actually, and also the economic growth rate projections shared by the international organizations, then we think and we see that Vietnam may have to encounter the new waves of the pandemic, whereas we still have not enough and sufficient supply of vaccines and medication. So in such the situation, there will be more risks and shocks, and then we recommend to upgrade or to increase the cash assistance programs with a larger coverage, and with the strong changes in the way to identify the people in need in order to include everyone. And then the level of benefit should be at least equal to the minimum living standard, as we may refer to the national poverty line for the period from 2022 to 2025. And the time span for the support should be in correspondence with the time that the people are subject to the social distancing or lockdown. And another recommendation is to improve and promote further the applications of the digital tools and technology in order to deliver more effectively and efficiently the support and assistance to the people in need. And as you may observe from the best practices of using Zalo Connect, then you may see that many people in need have had really received the assistance. And for the areas which are still subject to the high-level social distancing, then we need to learn from the experiences that, for example, Ho Chi Minh City, they have applied the model of the social security and social benefit bags with the veggies and essential foods or the hygiene items in order to maintain the quite normal daily life of the household. And then another recommendation is relating to the house rental for the migrant workers. And it's not really, very big pressure right now as we observe from our survey. However, there's still a need to support the migrant workers in order to have a better negotiation with the house owners to reduce or to delay the payment of the house rental. And there should be some more specific support to those migrant workers or the people who have to rent a house or some location for living. And The other recommendation is to help the people in the country to increase their capacity to respond to the risks and shocks, including the economic and social risks. And actually, there has been the program on that capacity building. However, we think that the most important objectives have not been yet achieved by this time, and we need to expand the objectives of the support even beyond the year 2022, and we should consider the investment for social security as the investment for the future. And we have had the decree number 20 from the government just issued in 2021 regarding the emergency assistance, but that kind of emergency assistance is more or less for the quite specific groups of people, but not for the massive assistance and support, especially during the pandemic times. And where we see that in that kind of very prolonged and at the very large scale impacts of the pandemic may happen. And also in terms of the Central Contingency Fund, there have been the news that the Central Contingency Fund is going to the very shortage of the resources. And for the provincial level contingency funds, it might be in the same and similar situation. Whereas to cope with and to respond to the pandemic impacts, we would need to have the much bigger resource. So if we just expect the provincial authorities to use the local contingency fund to cover the assistance and the social support, then it's really not a very effective solution, because in many cases the provinces cannot have a very abundant resources in order to deliver the assistance and support from those contingency funds. And then another point we would like to consider, we would like to recommend here that we may need to move to using another system for receiving the registration for support from the people in need, rather than to rely on the permanent resident address registration as we have been doing so far. So that's a very quick summary of our report on the second support package from the government to help people affected by COVID-19. And thank you very much for your listening.
Thank you very much, Ms. Pham, for your brief presentation on the second report, an assessment on the design and implementation of the government's second support package for those affected by COVID-19 pandemic. Well, I'm sure that you have a lot of questions that you'd like to raise to our speakers, and that is why we have invited today experts in this field along with the two speakers. Now, joining with us today, I would like to introduce to you, first we have Madame Pham, our senior economist, and she used to be a member of the advisory committee to the Prime Minister. We also have Mr. Jonathan Pincus, our senior economist at UNDP Vietnam, Mr. Nguyen Phong, head of the Inclusive Growth Unit of UNDP Vietnam, and along with these three panelists, we have Mr. Nguyen Thang and Ms. Pham, our two recent speakers. First of all, to warm up the panel a little bit, let me raise initial questions to our two speakers, and also I have a small note to you that we don't have too much time for this panel, so probably each of us can respond to the questions within 3 to 5 minutes. And I have a little reminder here for you. I will let you know about a minute or 30 seconds before the end of your allotted time. So the first questions actually are for Mr. Jonathan, Ms. Chilan, Mr. Phong. So you can share with us your thoughts of the key findings and recommendations of the two presentations. Madam Chilan, please. Well, first of all, I'd like to thank UNDP and I express my high regards to UNDP and our two research teams for the two highly valued reports and also very timely ones. They focused on the most vulnerable populations and hardest hit by the pandemic. Obviously, speaking of the extent of income reduction, well, there may be other larger absolute reductions, but probably regarding the relative reductions as a percentage of the income, probably the populations that we have looked at are those hardest hit. And we have to recognize that as a fact in order to devise appropriate solutions for them. And secondly, the impacts on them are often underestimated, and probably their roles are not recognized proportionately regarding their contribution to the national budget and economic growth. However, given the recent disruption of the supply chain in large areas such as Ho Chi Minh City and other urban areas, we only came to realize by then the significant roles they play in our entire supply chain, and their suffering also affected different aspects of lives of the people in Ho Chi Minh City. So the pandemic helps us realize their important role in the social and economic development of Vietnam, and their loss, their sufferings widen the gap, the rich and poor gap between different classes of the society. And we came to realize that we need to pay more attention to the vulnerable populations in the roadmap to growth. It is a pity that Mr. Thang didn't have too much time to do the research. His team was only given half a month to do the analysis, so they didn't have time to look into the agricultural sector. Instead, they focused only on those in the tourism sector and manufacturing sector in urban areas. Well, a fact is that those in the Mekong Delta region suffer significantly from COVID-19 as well. So hopefully next time, if you have more time and if you can focus on the agricultural sector, I think a better subject for your study may be our farmers in the agricultural sector, because the disruption in the supply chain means that they cannot sell their produce to the market, while they are subjected to higher living costs as well. Thank you very much, Madam Pham Chilan, and Mr. Phong, we'd like to hear from you next. Thank you very much. And I have a small comment regarding what we have heard extensively from the mass media already regarding the size of the cash grants offered to those affected by COVID-19 and why is it so moderate. And also we do know that we have recently a depleted National Contingency Fund, which requires additional allocation of 14 trillion from the National Assembly. And an additional comment I'd like to make following the two presentations. Now regarding the budget allocation for the contingency fund, which can be disbursed in response to shocks. Well, recently we still follow the conventional design. However, the design was first established in the absence of COVID-19 or a pandemic or a crisis of that extent. So the context is rather obsolete. However, our budget allocation still followed the conventional way. I would like to give you an analogy. So obviously, if we have a sick member in the family requiring treatment, then maybe we need to cut back on entertainment costs, like we stop going to the movies, or we need to borrow money to cover medical expenses for that sick family. However, in Vietnam, the size of the support package is very moderate. Tu said that it's about 0.4% of the GDP relative to the 5% of other countries. Well, the 4 to 5% of GDP from other countries is only dedicated to cash grant. However, in our 26 trillion Vietnamese dong support package, we had only 2 trillion dedicated to cash grant. and adding funding from the local governments, it may be maximum 6-7 trillion. So maybe we need to adopt a very different approach in designing cash grant support to the affected populations in the face of large shocks like the recent pandemic. And it has to be different from what we are doing. So often we plan for a contingency fund to be dispersed within the year. If there is no crisis, no natural disaster, so that the fund can be dispersed to respond to them, then the fund will be allocated to other purposes. I think, well, the fund should be carried over, if not dispersed, the fund should be carried over to the following years in response to larger shocks should they arise. So you might know that in this pandemic we have forced savings, right? And probably it would be wise for the government to spend in order to stimulate the economy. Thank you very much, Mr. Phong. Well, I'm aware that we have about 130 people following us through our Facebook channel and YouTube. And I would like to thank our online participants, and I would like to receive questions from you. And now we'd like to hear from Mr. Jonathan Pincus in response to the two presentations just now.
I'd also like to join the other panelists in, excuse me, in thanking the presenters for excellent research carried out in a very short period of time, which has been very revealing and extremely helpful for us to think about the policy response. I'd like to focus on the question of affordability that Pham was just been discussing. I think there's a concern that additional funding is not possible because of debt ceiling that the government faces and the possibility of inflation. But I think if we look in the region and look at the response of other countries, we see that the amount of cash assistance was generally much larger than in Vietnam, and the macroeconomic effect of that was positive in the sense that when we face a situation in which private consumption is being reduced because people are unable to spend or because people have lost income, then the economy is operating well below capacity, which is a loss not only to the households that are unable to spend on their basic necessities, it's also a loss to business. And as Madam Chilan was just saying, it's a loss to farmers who are unable to sell their product. And that causes what Pham was just saying is compulsory or involuntary or forced savings in the economy. And that is a net loss to the economy, but it also is an opportunity to mobilize those cash balances through consumption expenditure, cash grants to households, which will not only provide them with the necessities that they need, it will stimulate demand growth for businesses and for farmers, and it also generates tax income. So cash assistance partly pays for itself in terms of higher revenue for the government. And that's value-added tax, that's corporate tax, that's all the other taxes that are applicable to consumption and production. Now, the more that the cash balances are used for things that are domestically produced, in other words, things that are not imported, the higher the multiplier effect. In other words, the more benefit the economy gets in terms of national output. But most of the things that people are now unable to consume are domestically produced. They are food, housing, utilities and other basic necessities. There is some small import component in these goods, but it's actually quite small. So the multiplier effect of additional spending on necessities is quite large, which means that as consumption increases, as consumption spending increases, GDP growth will increase, there will be more opportunities for business, and there will be more tax collected. So on the whole, spending more money on cash grants for people who need it during social distancing, lockdowns, and so forth, is beneficial not just to those people, but to the economy as a whole. One last thing before I run out of time. I'd like to say that it's really important to recognize there's a difference between tax reductions and tax delays and consumption spending. The tax reductions do not have a high multiplier like cash assistance. The reason is that it's not necessarily spent, right? The tax reductions may be saved. And the one thing we don't need right now is more saving, we need more spending. So the way to ensure that the assistance, the government expenditure, is actually used for consumption is to give cash benefits rather than tax reductions. And I think I'll leave it there and turn it over to our other questions. Thank you very much.
Vâng ạ, xin cảm ơn cái
for the insights shared by Mr. Jonathan Pincus. So far, we have received a number of questions from the online participants. And maybe first of all, I would read out loud questions from Ms. Vân Anh from IMF office in Hanoi, and her question goes to Ms. Tu. I understand that the support package of 26 trillion VND mainly comes from the central budget and also from the social insurance fund. But for the informal workers or non-formal workers, the support to them shouldn't come from that budget. So if we here include the implementation for all kinds of the support programs, it should be higher than 26 trillion VND. So the 4,000 trillion VND to the non-formal or informal workers, does it come from the local or the central budget? Thank you very much for the questions from IMF. So let me say that the support policy to the informal workers is still included in the resolution number 68, but the government, the central government has requested the local authorities to identify the level of benefits and about the sharing or allocation of the resources between the central governments and the local authorities. Then there are only 3 provinces, Ho Chi Minh City, Hanoi City, and Bình Dương Province, who have to use their own budget in order to cover that assistance to the informal workers. For the other provinces, they may receive the 40% contribution from the central government and the 60% remaining to be covered by the local governments. But for the disadvantaged and mountainous areas, they may receive up to 80% of the financial contribution from the government, and they only have to cover by themselves 20% remaining. And so again, there is the difference level in terms of the financial contribution from the central government for that support program to the informal workers. Depending on whether the province is categorized as the better off province or a more disadvantaged province. So here there is some sharing mechanisms between the central government and the local authorities, but the poorer provinces will receive more financial contribution from the central government, but even the poorest ones still need to cover 20% of that support. Thank you very much, Ms. Tu. And now we have another question from Nguyen. The question seems to be not very clear to me, but please allow me to read it loud. Please give us more comments on the uncertainty of the pandemic. And we think that the pandemic will not stop here. So what will happen and what is the, let's say, reasoning about the pandemic? Yes, again, it's not very clear in the question. So, Mr. Phong, can you try to answer the questions? Well, very sorry that I myself do not fully understand the questions, but I try to make it, clearer from the perspective of, let's say, uncertainty of the pandemic. Because yes, everyone cannot be sure how long the pandemic will be and how it will be further developed. But if we work on the financial issues, then we always need to reserve a contingency, right? So now if we have some kind of the estimation that in the upcoming time we will need an additional fund of 14 trillion VND, then the government will ask for the National Assembly permission in order to fund another 14 trillion VND into the contingency. However, nobody can be sure whether 14,000 trillion is really sufficient or not, or it should be 24,000 trillion or somewhat. So here I think it depends on our forecasting capacity and the way we do the forecast, because we cannot come back many times to the National Assembly in asking for the modifications in their decision. So if we look at the cost sharing region between the central government and the local authority, let's say 80% from the central government and 20% from the local poor provinces, then sometimes I think that if the pandemic is getting worse and worse, then even such the 80 and 22% cannot work well, maybe the government will need to contribute more financial resources to the poorest provinces. For if I remember the first support package, which was implemented for 3 months, but then even in the July and August, the disbursement was not complete, and by that time, many households could come back to the work, and then they wouldn't need the support anymore. So I think here we need to think of how to increase the flexibility and more empowerment to the policy implementers. I mean that at the implementation level, the officers must be given more flexibility and also the empowerment. But yes, the other side of the story is in many cases our officers may be afraid of the responsibilities or accountability, and maybe they don't even dare to do anything, even if they have been empowered. So I think the other point, a very important thing, is we need to encourage the people to be brave enough in order to act within the mandate and the responsibility that they have been given. And we should not, have a kind of the stick system in order to penalize every mistake. I think that only the very serious or severe mistakes should be penalized in this pandemic period, right? And for the other cases, if the people or the cities or the provinces, they can be more creative in order to work more effectively, then we should encourage them to do so. Okay, thank you very much, Mr. Pham. So maybe the question here is about the thinking or the way of the mindset must be changed in order to adapt to the pandemic situation, right? So if we understand the question in that sense, then Mr. Pham's answer is we need to change the mindset in order to encourage the people to act and do not be afraid of making mistakes. So the most important part is to provide and deliver support to the people in it and the most vulnerable people. The other question from Ms. Nguyen: what would be the best solution to support the poor and the vulnerable people in the upcoming time? Okay, this is a quite general question. So Ms. Pham, please.
Well, first of all, I fully agree with the recommendations proposed in the 2 presentations and also in the policy brief drafted by Mr. Jonathan Pincus, that we need to have a more timely and direct measure to support the poor and vulnerable populations we should not waste too much time in targeting and categorize them into different groups. While I don't think it's too difficult if we change our mindset regarding the contingency fund, as Phong mentioned, and to give more ownership to local governments or even the government. But in that sense, we probably need to adjust the state budget law to expand the mandate and authority of the spending units. For example, when we can have additional allocation to the contingency fund in response to emergencies. For example, we can collect additional revenue from environmental fees / tax or petrol tax. Now, in the midst of COVID-19, we have a significant reduction of traffic flow. So the revenue collected from environmental fee can be mobilized as cash grant to the poor. Right, so we have surplus here and there, and we should not be too separate between spending for healthcare and spending for other predefined items, because the government has collected its revenues from different sources, and people, regardless of their rich and poor status, have all contributed to the state budget. So it may be one way of how we can do better. And well, I think regarding budget allocation and the mentality of our civil servants, we need to be mindful of the fact that the state budget comes from contribution of every people of Vietnam, rich or poor alike. So in case of adversity, we should return the contribution to them, rather than seeing that as a bestowment of anything to them. Well, actually, nobody wished these adversities upon them, but in case of adversity, we need to share or even return the contribution to them. And regarding the sources of fund, apart from budget allocation, we should mobilize contribution from different entities throughout Vietnam. From the experience of Ho Chi Minh City and southern provinces, we have observed a great sense of social solidarity and mutual support. Well, we haven't got a chance to take full stock of the amount of contribution that we have gathered from private and public sector alike, but I don't think that private sector contribution is any less than the public sector. And maybe it's even more effective as well, because neighboring support is the most compassionate form of support, people living closer, supporting each other. And we should make it possible, like building an enabling environment for localities and neighborhoods to support each other rather than to hinder it. Another thing I'd like to mention, which is not in the presentation yet, but apart from the cash grant, we should find ways to reduce any other barriers that may make the lives of the general public more difficult. Speaking of education, for example, almost all schools have switched to online platform, but that means a much higher cost for poor households. For example, if they have 3 or 4 children, they may need tablets or laptops to enable online learning at home for the children. So, well, online learning is good, but on the other hand, we need to think of the support required for people in disadvantaged conditions, how to save money for them, how to make it easier for them. We should try to be not too strict with social distancing or lockdown measure to avoid wasting of resources or too costly solutions. Thank you very much, Madam Phạm Chi Lan. I've seen a lot of heat here, and I would like to hear more from you as well. Well, regarding Ms. Nga's question about how to disburse the cash grant as fast as possible to those in need, I'd like to share with you the experience of other countries around the world, and also speaking of Vietnam's lesson. From the financial crisis that dates back to 1990, there was a report that says that if there is a country that can disburse the money in its time to like in normal time to the general public, then it's the best way, because it would be very difficult to devise a completely new policy in terms of prices. Well, we can think back to the first support package, and also you can look at some of the diagrams in the presentations regarding the second package as well. If there are certain beneficiaries who we do know where they are, and if they have satisfied all of the eligibility criteria, then it will be very quick to disburse the cash grant to them. And if we try to think of new categories of beneficiaries, then it will take a lot more time to get disbursement. And universalization has been adopted by many countries as an approach for effectiveness. And I have heard of an approach that it is rather to have inclusion errors rather than omission or exclusion error. And in Vietnam, given the budget constraint, probably it's very difficult to disburse the cash grant to every single one. So I think at least we should target the vulnerable populations. For example, the defined beneficiaries of regular social cash transfers on a monthly basis, elderly people, children, or people with disabilities. We need no administrative procedures apart from their identity card. Right, and then some of the money may be disbursed to the well-off, but as I mentioned, the principle is to better have inclusion error rather than exclusion error. And experience across the globe has shown that while rich people were not bothered to waste time to submit all sorts of paperwork to get considered for the cash grant, and it would not be too big a waste to have exclusion error in this case. And then in Vietnam, we have got certain universal policies already. For example, for elderly people age 80 and above, if they don't have VASS salary or other forms of social assistance, they can get cash grants as well. And they are the beneficiary to get disbursement the fastest because they are automatically eligible, right? And then if we are too late to disburse the cash grants to other groups, they may have dropped out of important opportunities. And then let's say if we have a third support package, we should try to disburse it within at most a month. We have got digital tools already. We have electronic payment. We can have Zalo Pay, e-wallets, etc. So we can do all sort of things if we know how to leverage the existing online and digital instruments. The first thing to bear in mind is to make sure that nobody suffers from hunger. And thank you very much, Phong. I know the message is better to get inclusion error rather than exclusion error.
Yes, so next question is from Ms. Vân Anh about the pregnant women from Dong Nai province. They want to come back to their homeland in Nghệ An province. They have registered, but the Nghệ An province doesn't want to receive them yet. So what would be the instruction from the MOLISA for the provinces in that case? Well, our Vice Minister Nguyễn Thị Hà just issued a decision this morning and sent to all the 63 provinces and asking them to facilitate everyone, including women and children, or especially women and children, if they want to come back to their hometowns. And the provinces are also requested to provide any possible support, and not only in terms of cash assistance, but any other types of the possible support to those people in it who want to come back to their homeland. Yeah, so that's the answer for the time being. Yes, thank you very much for the answer. Another question from Minh Châu. So in the provinces, I understand that once the contingency fund has some savings, then they do not carry it over to the next period, but they would like to use it up for any other purposes. So what would be the instruction from the government, from the central government, in order to deal with that situation? Anyone who want to take that questions? Okay, Mr. Pham. So as I said before, actually here the contingency fund can be used for different purposes. So at the local level, if they have some savings in the contingency fund, then they may use it for, let's say, renovating buildings or offices, for example. But here in our report, we recommend that we should establish the social security and social benefit system that will have the capacity to respond to all kinds of the shocks, including the very large and prolonged shocks, because those kind of shocks will probably happen in the future. For example, the drought or the salinity intrusion that have already happened in Vietnam before. So if we cannot have a good cumulative financial resources in the contingency fund, then it will be very difficult for us to respond to those the large scale and prolonged shocks and crises. So here again, we recommend that we should have another approach for financing the contingency fund, and if we have savings for this year, we still need to keep it for the following years. Okay, another question for Mr. Jonathan Pincus. Question from Nguyen Tien. Now the government budget is exhausted, and what would be the solution to increase the revenues to the budget in the fastest way and with the concentration of the public debt issue? Mr. Jonathan?
Well, I think it's quite clear that it needs to be borrowed, and it can be borrowed domestically. As I said, because there's a reduction in spending, there are forced savings, there are cash balances that are building up. And so it's a rather simple process that the government does every year, several times a year, which is to issue domestic debt. And as I said, also, the benefit of cash assistance is that some of this will come back in the form of higher revenues for government. So that places some limits on the amount of additional borrowing that needs to take place. But I don't think that it's a problem for the government to borrow more in the final quarter of this year. I think we're quite far away from the national debt ceiling still. And I think there is a lot of forced savings in the economy that could be borrowed at a very low cost. Interest rates now are very low, so it's not very expensive for the government to borrow domestically. And if the borrowing is entirely domestic, then there's no real problem for the balance of payments, and I think not for inflation either, primarily because demand is at the moment very suppressed. So I would say in the immediate term, what we at UNDP are arguing for is a cash assistance program on the order of something like 5% of GDP in the final quarter, which is about 77 trillion Vietnam dong. And that is certainly well within the government's ability to borrow that domestically by issuing bonds.
Vâng ạ, xin cảm
Có thể là huy động vốn từ trong nước. Yes, thank you very much, Mr. Jonathan Pincus. The next question from Nguyen. What are the main reasons for the low disbursement rate of these support packages in general? Do you think it's because of the administrative procedure or due to the shortage of the budget in the provinces? And what would be the solutions, right? Then who wants to take the questions? Ms. Tu or Mr. Thang, who are now participating on Zoom? Yes, Ms. Tu, please, and then Mr. Thang. Thank you very much for the question. So in general, we know that the disbursement is slow, and we need to look at different policy options in order to find out the specific reasons leading to the slow disbursement rate. So the three main groups of the policy options first are relating to the social insurance payments, and then cash assistance, and then the providing loans to the companies or enterprises. Then for the first group of the policy option, the slow disbursement rate is mainly related to the administrative procedure, which are quite complex for the people in need to access to the support, whereas the level of benefit is not really attractive. And quite the same thing for the loans to be provided to the enterprises. Or even the policy option for training to the workers. So the support for that policy option is only 1 million VND per person, but the companies will need to submit a lot of different documentations and papers, including the training plan and so on. And I also mentioned the other point about the cash assistance program. Then through our survey, we found that the decision-making power from the local authorities, is different among the provinces. For example, Ho Chi Minh City or Hanoi City or Bình Dương provinces. These are the 3 provinces who do not receive any financial contribution from the government for the cash assistance programs, and then the disbursement is the fastest in those 3 provinces. Yes, of course, we understand that those 3 provinces, they are the richest. Yes, they are the most better off provinces. But again, that's something that we need to look into. And again, as I said before, so far the cash assistance were only provided to, let's say, 4 million people. And among them, more than 3 million are the informal workers. So here I think that the provinces, they need to do better in terms of balancing their budget resources in order to decide how they will deliver the support to the people. And for cash assistance, I think it's relating to the budget allocation or the budget availability in the provinces. But once the province can have enough budget for cash assistance, I think that they can do it with a good disbursement rate. Thank you.
And we have another question to Mr. Nguyen Thang, and as the first Vice Chairman of the Socio-Economic Advisory Council of Vietnam Academy of Social Sciences, could you please tell us what recommendations you have regarding the solutions to promote economic recovery at the end of 2021 and into 2022? Well, thank you very much. Let me clarify a little bit regarding our survey sample. It actually includes agricultural households as well. They're also part of the sample along with those exposed to high risk in the tourism or manufacturing sector. So that is regarding the sampling. And before getting to your question, let me add another point explaining to you why we are now facing the challenge of slow disbursement of the cash grant package. As the government has said, while a penny in case of hunger is $1 in case of nourishment, so given the high uncertainty of the current time, we probably need to speed up the disbursement a little bit. We probably need to have the automatic stabilizers and automatic triggers as well. So this is in case of a pandemic, but later on we may face a natural disaster or some other disaster as well. While social insurance is an example of automatic triggers, and we need some measures to create larger spillover impacts as well. And in order to do so, we need to address the administrative bureaucracies, and we need to get prepared. For example, in response to new waves of COVID-19 or other shocks, we need to be well trained in digital skills or job transition skills, and regarding the third line of defense in the triple lines that I've mentioned. And as mentioned very clearly by other panelists before, and to follow from Mr. Phong, we need to speed up the digital transformation process to have a higher rate of adoption of information technology, to improve transparency, to reduce duplication in delivering the support benefits, especially the National Citizenship Database effective from the 1st of July 2021. Also, we need to strengthen post-inspection, post-disbursement inspection. So if we later on detected that we have got inclusion error, then we can have a refund from those who accidentally or mistakenly received the cash grant. Among the effective solutions, I think the top priority is to get vaccinated or through COVID-19 shots. So that's definitely the top priority, and we should learn from the experience of other countries to live in cohabitation with COVID-19. The higher the rate of vaccination, the higher the likelihood that we can address supply chain disruption. Obviously, we need to make sure that the economy doesn't get overloaded. So vaccine is key. COVID-19 medicine is key. Another thing is that among the provinces, they are still waiting for funding allocation from the government, and they are looking towards the government to reopen. As I mentioned in my presentation, we need a phased approach to promote the recovery, and we need to rely on certain metrics to design proper reopening solutions. And if we can have higher vaccine coverage, then we should prioritize reopenings in supply chains of global scale, because while external investors have officially conveyed a message to the government regarding their concern of a disrupted supply chain, I think the government is traveling in the right path, and in the next month or two, once we can increase vaccination rate across the country, we can have a stronger growth path. And also, we have the advantage of new generation of free trade agreements, including CPTPP and EVFTA. And obviously, it is reasonable to get concerned about the short-term disruption of the supply chain. But we need to address them promptly so that we can still tap into the opportunities presented to us. Obviously, we need a roadmap to reopen, for example, first with the green zones. In order to do so, we need to speed up the pace of COVID tests. And regarding social distancing, we can learn from the experience of other countries. Regarding the agricultural sector, as mentioned by Madam Nguyen, we have disruption of the supply chain, making it impossible for farmers in rural areas to sell their produce in large urban markets. So they suffer from income loss and a further disadvantage by increased living costs as well. So if we can reduce the disruption in the agricultural supply chain, they would help immensely with the agricultural sector. And as Mr. Jonathan Pincus mentioned before, the government should increase the scale of the cash grant support. And the additional household income will be spent purchasing domestically produced goods and services. And I'm optimistic that Vietnam can embrace on a recovery path in the next 3 months, provided that we can increase our vaccination rate. And that's it for me. Thank you very much.
Yes, thank you very much, Mr. Nguyen Thang. So We have run out of the time for the Q&A and open discussion with the panelists. There are still many more questions that we have received from YouTube and from UNDP Facebook, and we will send those questions to the panelists, and then we'll share the answers on those two platforms. And you can also download the two reports from the UNDP Facebook link. And may now invite Mr. Terence to have the closing remark.
Thank you very much. Well, first of all, let me give my congratulations to our two distinguished presenters. I think their analysis has stimulated the other presenters also, and as we've noted, also a series of very pertinent questions that have been responded to by our panelists. So I hope the experience this morning has enriched everybody in better understanding the experience of coping with the pandemic in the last few months and what possible solutions there are in the immediate term to responding to its impacts. And I think we've heard this morning confirmation of the importance of escalating the size of the financial response to assure rapid and much larger distribution of cash transfers as the most empowering and important way of mitigating the impact of the pandemic on millions of Vietnamese. Also, we have heard that in the medium term we need to look at the systems, not only the fact that they should be digital to expedite their implementation, but the systems themselves need to be able to respond to the urgency and the changing circumstances of the pandemic and other emergencies that are bound to strike Vietnam. A number of other UN agencies are undertaking similar assessments from their particular perspectives, but I would like to congratulate the two institutes for the assessments they have made, and to encourage more frequent assessments as a way of guiding government and society in how best to respond in very rapidly changing and uncertain times, as we have seen over the last few months. It behooves us, I think, to invest in that capacity and have much more rapid feedback loops so that decision-making can be well-informed and persuasive in mitigating the impact of these disasters. And I think it's, the collective aim is to make sure, as has been highlighted here, that we are more universal and inclusive in designing those packages and implementing them. And of course, we can correct later. But if we are to ensure that no one is left behind in responding in a robust, sustainable and inclusive manner to recovering from the pandemic, then these systems and these resources are vital for doing so. Again, let me thank all of you online. Let me thank our presenters, the panelists, the interpreters, and the others who have supported this online launch of these two important reports. And we welcome the continuing dialogue and discussion that should be stimulated as the government reconsiders how best to respond to the ongoing impact of the pandemic. Thank you and good morning.